All right. Good evening, everyone, and thank you for joining us for part 4 of our financial planning series. We're a little bit over October, but we kicked this off as a way to celebrate Spina Bifida Awareness Month and as well as Financial Planning Awareness Month. And we are wrapping up with probably one of the most important topics that we've booked, and it's all about public benefits and financial literacy. What do you need to know? I'm so grateful to have Lisa Brown here. She's a program specialist at NIAS, which is New York Employment Service System, and they are an incredible resource for all things employment. And today we're going to focus on public benefits and financial literacy. So I'm going to pass the mic to Lisa, who will get us going.
Good evening. Thank you. Tonight, I want to just touch base on public benefits and financial literacy. And please feel free to put your questions in the chat, and we'll cover those as we get to them. Another thing I wanted to let you know is that this PowerPoint will be available to you after today's training with some additional materials that I'm going to send along with it. So the first thing we want to talk about is Social Security benefits and financial literacy. So it's really important that anyone who's receiving Social Security benefits should have access to someone who's called a benefits advisor. And this is a person who will help you address the specific questions you have about how your benefits will be impacted when you decide to go to work. So tonight we're going to cover some basic topics. NICE, that's where I work. As Julia said, it's New York Employment Services System, and we are considered a resource for all things related to employment. We'll talk a little bit about why working is a good idea. There's a lot of different reasons for that. We'll talk about specific benefit basics, including SSI, SSDI, and then some work incentives that are related to both of those benefit types. We'll also consider some information about Medicaid and Medicare and how you can keep your healthcare benefits when you decide to go to work. Again, specific work incentives. We'll talk a little bit about Ticket to Work. And then the last part of tonight's presentation will cover financial literacy. Okay, so New York. Okay, sorry about that. So this first section is called New York Employment Service System, and we are a direct result of the collaboration between the New York Office of Mental Health and the New York State Department of Labor. And because of those two, that partnership, we were created. We also have state partners with all the others listed on this slide. And together we work as a partnership. We're a collaborative employment services case management system. We are a Ticket to Work administrative employment network. So if you're familiar with Ticket to Work, you might know about that information. We'll talk about Ticket to Work in a little bit. And we're a primary employment services data source. So we have information to share with you about going to work and what that means for you. So we want to talk about going to work and why it is a good idea. Even if you're receiving Social Security benefits, SSI, SSDI, it's still a good idea. Research has shown that it is a social determinant of health, including your financial, physical, and mental health. But also, it's a great way to have socialization, meaningful activity to your day, creating self-worth and a good work ethic, and then an overall improved quality of life. So working is a great idea, even if you're receiving benefits. So one of the things that we need to talk about, and as I mentioned before, you don't have to be a benefits expert, but there are a couple of things that you should really be aware of. And one is that you'll have more money in your pocket at the end of the day, and you won't be penalized for working while you receive your SSA benefits, but you have to remember to continue to report your income. So one of the things that sometimes people forget is to report their income, and then that gets them in situations of overpayments and has a lot more downside to that. So it's really important to remember to report your wages to Social Security. You will also be likely eligible for free Medicaid in almost all scenarios, and we'll talk about that in a little bit. And then we all know people who have gone to work and receive public benefits, and they have things happen to them that are scary for them, losing their benefits or losing their health care. And some of that information is just a myth. And we really need to keep talking about it. We have to have conversations about those things because we want to make sure that people are getting the real idea, the real information about that. So one of the things that I would recommend for anybody receiving any type of public benefit is to have a benefits advisor, somebody that they can talk to about how working will actually impact those SSA benefits. And it's not just for SSA. It would be for any type of public benefit, including food stamps and other TANF benefits, all of those sorts of things as well. If you don't know who to talk to about a benefits advisor, if you don't have a certified benefits advisor available to you, you can always contact NICE and we will help you figure it out. In addition, you should have a website that you can go to get benefits information. And again, if you don't know, you can always call me. We can talk about that. But you can also research our website, and that's nice.ny.gov. And if you look under the customer information tab or customer resources tab, you will find information about public benefits, SSI, and work incentives that will help you keep Medicaid, Medicare benefits. In addition, the Ticket to Work website has information, and that is choosework.gov. And so that would be a good resource for you as well. Tonight, we're going to talk a little bit about the basics. And so if you have additional questions, feel free to give me a call if you want to talk about your personal situation and going to work, or we can talk about it at the end of the training today in the chat. But SSI and SSDI are separate Social Security benefit types, and they calculate wages in very different ways. But in either case, working is a good idea. Wages must be reported in all scenarios to prevent the overpayments that I mentioned before. And if an individual earns enough for cash benefits to stop, so you're no longer receiving SSA benefits, there are multiple ways to continue to get free Medicaid. One of those is the 1619B of the Social Security Act, and we'll talk about that in a little bit, and also Medicaid buy-in for working people with disabilities. So there are two options to be able to help you keep your Medicaid. In addition, if an individual would like to save more than what's allowable on the resource limits for SSI, there are ways that you can do that as well. One is through Achieving a Better Life Experience Act, which is ABLE, and then the Plan to Achieve Self-Supports, which is a PASS plan. And we'll talk about those two in a few slides as well. So let's first cover healthcare benefits. So if you're working and you're receiving SSI and you receive Medicaid, and then you become, or you're making more money than the rules allow to maintain Social Security benefits, there is an automatic process that happens. It's called 1619B, and it's a special Medicaid rule that allows an individual to maintain Medicaid coverage even if their earnings become too high for them to still keep SSI. So if you're eligible for 1619B, it should be an automatic, smooth process. But sometimes with SSA, it's not. And so there is a template letter on our website that you can complete and send to your claim representative at SSA to let them know, hey, I'm earning more wages than I'm allowed to for an SSI cash payment, and I want to talk to you about 1619B. I think I'm eligible for that. So that's a template letter that you can get on our website. The eligibility requirements for Medicaid 1619B is just that you were eligible for SSI for at least 1 month, that you would still be eligible for SSI except that your wages are too high. You still must have a disability and meet all of the other eligibility rules, including the resources test. You do need to have Medicaid in order to work. There's no other medical insurance out there for you. And you have gross earned income, but it's insufficient to replace your SSI cash payment or to replace your Medicaid healthcare. So with all of those eligibility requirements met, you certainly can be eligible for the 1619B. And that is a huge relief to people, because one of the things with working is that you want to be able to go to work, but you're afraid to lose either your cash benefit and your health care. Those are huge concerns. So there is help out there, and you can work and still receive your Medicaid in most cases. Another rule that helps with Medicaid is called Medicaid buy-in for working people with disabilities. And this is a program that offers Medicaid coverage to people with disabilities who are working and they earn more than the allowable limits for Medicaid. And it's free. So you may have gross income as high as $68,988 for an individual. You may have non-exempt resources that do not exceed the resource level. And you may be able to then maintain your Medicaid if you buy in. Buy in just means that there may be a premium attached to it. So you may have to pay some money for a premium. But the Medicaid buy-in program offers this coverage to people for free. So to learn more about this information, there's a link listed here on the slides, and you will get a copy of this so you can follow up on it if you'd like. And it's called the MBI Toolkit. And so you'll be able to see that information there. Okay, and then most people who are receiving SSDI benefits, Social Security Disability Insurance, are also eligible for Medicare coverage. And following the trial work period, which is something that you will have, and we can talk more about that too if you have a question, but following the trial work period, individuals can still continue to receive Medicare coverage for at least 93 months. And that's 7 years and 9 months. So that's a long time to still be eligible for Medicare. And that includes hospital insurance, which is Part A, and you get that premium free. There's no premium attached to it. There's supplemental medical insurance, which is Part B, and that's only if you've already enrolled in it. So the thing about that is you have to enroll in it at the time. If you don't, and you decide to do it later, there's a premium attached to it, kind of a fee to have it later. But you can have supplemental coverage, which is Part B, and also prescription drug coverage, which is Part D. And all of that is still available to you for at least 93 months. And then after the premium-free Medicare coverage ends due to work, you can buy continued Medicare coverage if you still remain disabled. So there are a lot of resources and things available to you if you decide to go to work and you still need to have your Medicare or your Medicaid health coverage. So if you have any questions about that, please don't hesitate to reach out. We'd be happy to talk to you more about that. Okay, now we're going to talk a little bit about SSI benefits. So SSI is a program that provides a cash benefit for people who have limited income and limited resources. So the resource limits in 2022, is the single individual is $2,000 and an individual with a spouse is $3,000. So those resource limits could change year to year, but at this point right now, it's $2,000. There are also some SSI work incentives associated with receiving SSI benefits, and those include the student earned income and impairment related work expenses and blind work expenses. So those are all available to you, even if you're earning SSI and you want to go to work, you do have these work incentives to help you maintain as much of your SSI benefit as you possibly can. So the student earned income exclusion would allow a person who is under the age of 22 and they regularly attend school to not count earnings from income a certain amount of earnings per year. So in 2022, that amount can be excluded is $2,040 a month, up to a yearly maximum of $8,230. So if you're in school and you're under the age of 22 and you're also working, you may be able to exclude amount of money so that it does not impact your SSI benefit. Another benefit is called the impairment related work expense, or an IRWE as it's called. And an IRWE is a cost of items or services that you need in order to go to work because of your disability. And Social Security will deduct the cost of an IRWE from your countable income when they determine your eligibility for Social Security disability benefits. So an IRWE could be anything that you pay for and you're not being reimbursed for. And it could be medications. It could be, and they can include over-the-counter medications as well, not just prescription. They could also include medical supplies or personal assistant, anything that you pay for related to your disability that's not being reimbursed. So an IRWE is really important because that will, and they can deduct the full amount. So you would save your receipts and then you would submit that to Social Security and let them know, hey, this month I'm going to count this medication as an IRWE and it's $72 or whatever it is. And so you can add that to your list and subtract it from the wages that you earned so that it's not counted as income. Another SSI work incentive is a blind work expense. And I don't have a separate slide for that, but a blind work expense is anything, if you have a visual or if you are blind or have a visual impairment, a blind work expense is anything that you need in order to go to work. It doesn't necessarily have to just be for your visual impairment. It can be for any expense that you have to go to work. And so that also is something that's really important. And as I mentioned, it could be medications, it could be some kind of device that you need because of your disability, and it's not being reimbursed to you from anybody else. So those are really important to know about. So now let's shift our gears a little bit and talk about SSDI. SSDI SSA provides cash benefits to individuals who have worked and paid into what's called the SSA insurance program. And that is the amount that you receive based on the earnings that you've done in the past. So the more that you've worked and the higher wages that you've earned will give you additional SSDI benefit. So there are several different work incentives that are available for people who receives SSDI. One is the trial work experience, which we talked about before, trial work period, the extended period of eligibility, and then the expedited reinstatement of benefits. So the trial work period allows you to test your ability to work for at least 9 months without losing your SSDI benefits. During that time, you can earn or make as much money as you want to or as you can without it affecting your benefits. You will receive the full SSDI cash benefit regardless of how high your earnings are. But again, it's really important to report your activity, your wages and your work activity to Social Security so that they know, that you're letting them know what you're earning so that they can monitor that. Your trial work period begins when you earn over $970 per month. And that is called the trial work level. So during that 9-month period of time, each month, Social Security will look at how much you're earning. And if you earn $970 in 1 month, that's called the trial work level. And then you've used up 1 month of your 9 months trial work period. If you earn under that $970 per month, it does not count as a trial work period month. So it depends on what your earnings are as to how many of those 9 months you've used. But it is available for the entire 9 months. You can make as much as you want without it impacting your benefit. The trial work level that's listed there is for 2022, And that also may change in the next year. We also have what's called the extended period of eligibility. So after you have after you've used all the trial work period months, those 9 months, and that ends, then the next 36-month period is a time called the extended period of eligibility, and it automatically kicks in. During that time period, you will continue to receive your SSA cash benefits for all of the months that your earnings are below the SGA level. If you continue to have a disabling impairment, the SGA level is called substantial gainful activity, and that is $13.50 per month in 2022. Anytime that you earn over SGA level, then you will not receive your SSDI check that month. But if you earn over and then the next month you earn less, you will not you will receive your SSDI cash payment the month that you go under SGA again. So it's that 36-month period where you'll receive your cash benefit for any month that your earnings are below SGA, and you will not receive your SSDI cash payment if your earnings go above the SGA level. There is also another period that follows the extended period of eligibility, and that's called the expedited reinstatement. And this is a safety net for people who have successfully returned to work and their SSDI cash benefits have been terminated. So if you go to work and you go through that 9-month trial work period, and then you start the extended period of eligibility for 36 months, and now you're working over SGA every month and things are going great. And then all of a sudden something happens and maybe you've lost your job. And so if it happens within that 5-year period that your benefits have been terminated, then you can call Social Security and say that you want to have expedited reinstatement. And you would just give them a call or send them an email, go to your local office and talk to them about that. And they will do a review of whether or not that's something that we need to do, is have expedited reinstatement. But during that 6 months of the review, they will give you your SSDI check. And if they decide at the end of that 6 months that they are not going to reinstate your benefits, you do not have to pay back that 6-month period of time that they gave you your benefit. So expedited reinstatement is a really good safety net for people who lose their benefit because they're working, and then something happens and they're below the SGA level again. The only other thing that you would be able to do at this point is complete a new SSI or SS application, Social Security application, and reapply for benefits, or you would ask for the expedited reinstatement. Okay, there are also a couple of ways that you can save money without it impacting your benefits. So there is an ABLE account, Achieving a Better Life Experience. An ABLE account is a savings program for people who are eligible and they have a disability, and their resources would make them ineligible for other benefits. So for example, if you're receiving SSI benefits or any other type of benefit, but you receive money, let's say you get an inheritance and it's $10,000. And now you have way over the amount of resources that you can have to receive SSI. So in order to not lose your benefit, you could put that $10,000 inheritance money into what's called an ABLE account. You could put that money in the savings account and then use that account to pay for any medical or living expenses in order to maintain your health, independence, and your quality of life. But it does not impact and it doesn't count as a resource for SSI benefits. Another option that you would have is called a plan to achieve self-support, which is a PASS plan. And a PASS plan will allow you to set aside money other than SSI. So it has to be other money that you have coming in for a specific time period so that you can go to work and achieve your work goals. So you'd have to come up with a specific work goal and write up what's called a past plan and have that approved through Social Security. And then you can save your money and work toward that goal. So it might be saving money to buy a car so that you can drive to work. So as you do that, it's not impacting your SSI benefit. You're saving money to reach your goal, and Social Security has agreed to do that for a period of time. And so that's a past plan, and that's also very helpful for people. The next thing we want to touch on is Ticket to Work. Ticket to Work is an employment program through SSA that can work in coordination with all of your existing supports. So it's really important to know that it is completely voluntary, and it provides you with more resources to be able to help you obtain a job and then maintain that employment. And it's no cost to you at all. So the only eligibility requirements are that you are currently receiving SSI or SSDI, that you are between the ages of 18 and 64, and that you want to go to work. So those are the requirements. And one of the things that you can do is to find a local provider to help you go find a job and go to work. You can contact me. We have what's called a locator map, and I'll just need your zip code and find resources within your area. And then I can give you names of providers that provide these types of employment services for people. And it could be things like updating your resume or practicing interview skills. Maybe it's job lead research. Maybe you guys are looking for a job together. It could be organizing an interview with a business. It could be a lot of different types of things, but once you get your job, then in order to help maintain your job, you might need what's called job coaching. So you might need someone to come in and talk with you about how to do your job more efficiently, or just give you support. If you just need some support on the job, that's available as well. So there's a lot of different providers out there throughout our state, and we have access to a lot of providers in all the corners of the state. So we'd be happy to help connect you with someone that can help you with what you need. If you go with the Ticket to Work program and you assign your ticket to an employment provider, then Social Security will suspend what's called the continuing disability review. So if you receive Social Security benefits, every so many years, you have to go through a continuing disability review to make sure that you're still eligible to receive benefits. And so if you're working with an employment provider through Ticket to Work, they will suspend that. You won't have to go through that process if you continue to make timely progress. So there will be some things that you have to do. You have to go to your appointments. You have to actively look for a job and work with your employment provider. So the employment provider can assist you preparing for, obtaining, and maintaining employment. And the employment provider can also offer benefits advisement so that you can better understand how working will impact your benefits. And even if the provider doesn't have that service available at their agency, we would recommend that you get a referral to someone who can provide that for you. So whichever company you work with, they will be able to know someone who can refer you to other agencies to get a benefits advisor if you need one. Okay, so the last part of our training this afternoon is called financial literacy. And this is where we want to talk about budgeting, saving, use of credit cards, something called predatory lending, and then building up your credit score. So the first thing that we want to talk about is helping you become more financially self-sufficient. And in order to do that, there's this thing called budgeting. And actually a budget is just a list. It's a list of all of the total income that you expect to receive that month. And that means from every resource. So from Social Security benefits, maybe child support payments, maybe an inheritance or a pension, any type of income that you're having. And then also a list of the money that you plan to spend. So that includes your bills like your electric bill, your rent, the gas that you're going to put in your car to go to work, any of that information. So everything you have coming in and everything that you have going out. And that includes the needs and the wants. So sometimes we want things that aren't really a need, but it's still on our list because it's something that we want. And so all of that information should be documented. And then we want you to keep track of where you spend your money, how much each money costs, or how much each thing costs, and making sure that you have a direct representative of what it is you're spending each month. And then each month, check that to make sure that you're working, spending within your budget, spending within your income limit. If you're not, if you're spending more money than you actually have coming in, then it's time to make some decisions about how to make that different, how to make it better. So then one of the things that we can talk about is saving. And we talked about those plans, the past plan and the Achieve a Better Life Experience and ABLE account. You can set money aside in order to buy things that can help you with your work goals, your living expenses, and your life dreams. So saving is really important part, even if it's $5 a month or $10 a month. Just opening a savings account and making yourself do that. That will turn out wonderful in the future. So that's very helpful. Even if it starts very small, it can build up. So I would recommend that as well if you're able to do that. The next thing we want to talk about is credit cards. So credit cards are really tempting because you can buy something that you want and charge it, and then you don't have to pay it right back for a while. You can pay a little bit each time till you get it paid off. But the thing about credit cards is that they'll send you a bill and they'll ask you to pay a minimum balance. And the minimum balance doesn't cover all the expenses that are associated with it. So for example, the minimum balance is, the payment is the smallest amount that we borrowed, but it doesn't include the interest. And oftentimes credit card companies charge a lot of interest on the amount of money that we borrow. So it's just really important to be aware of how much you're charging and whether or not you can really afford that. The principal is the actual amount of money that you borrowed, does not include interest. And the interest rate is the money that's charged for what we borrow. And oftentimes, for a credit card, it can be 10%, 12%, 15%, which is a lot of money in the long run. So one of the things that's important to think about when you're paying off your credit cards, that you should start with the credit card that has the highest interest rate to get that one paid off first, and then the next highest, and then the next highest, so that you are taking care of the biggest expense first. There's also credit card traps. So when you're looking for a credit card, and it might be important to have a credit card for emergencies, but you have to compare the credit card companies and get the lowest interest rate, pay your bills on time, and try to pay more than the minimum balance, even if it's just a few dollars more. Limit the number of cards that you actually have available to you. And they recommend that if you keep less than 30 to 40% of your total card usage under, so 30 to 40% card use of your total line of credit. So that's what they recommend. And then try to only charge what you can pay for. And I know that's difficult sometimes, but it is one of the recommendations that we try and just do what we can do. There is this thing called predatory lending. And one of the things that we should look at is if it sounds too good to be true, it probably is. So if somebody is saying, hey, I'll give you this much money, and it's going to be easy, it's going to be, it's not going to harm you at all, I would think that you might look at it a little bit closer. So predatory lenders usually charge a very high interest rate. They offer to loan you more than you can actually afford. They offer deals that seem too good to be true. They pressure you into making quick decisions, and they ask you to sign paperwork that is really difficult to understand. So if you have to borrow money, you might try to borrow it from people that you know and that you trust. and try not to borrow more money than you are actually able to pay back. So one of the ways that you can build your credit is taking a look at your credit score. So you're entitled to get a free credit score every year, and you should review it every year and review it for accuracy. So they're actually looking at how many credit cards you have open, how much money you actually owe to various businesses, and how you've been paying it back over the last several years. So credit scores range from 300 to about 850, and they are categorized as from poor up to excellent. And if you're striving to have a good credit score, that's between 670 and 739. So as you build good credit, these are some of the things that you can do. Have a steady work record, pay your bills on time or as soon as you possibly can, open a checking or a savings account, apply for small loans or credit cards that you can pay back on time. So if you're going to buy something, on a credit card, you would use one credit card and you would pay it off as soon as you can before you would charge something else on it. And then keeping less than 30 to 40% of your credit used of your total credit line. So if you have a credit line of $1,000, 30% of that of $1,000 would be $300. So you wouldn't want to charge more than $300 on a $1,000 credit line. We would want to keep it less than that. Okay, and that is the end of our training today. If you have questions, so this is my supervisor, Andy Sink. He's the director of our program at NICE. My contact information was on the first page of the slides, Lisa Brown, and feel free to give us a call, send us an email if you need more information, if you have questions about anything. I know Julia is going to go over if there's any questions in the chat. So thank you very much for letting me come. I really enjoyed it.
Thank you, Lisa. So as she mentioned, if you have any questions, put them in the chat and we will answer them live now. And if not, we'll get you her information. Thank you.